Soldier lies on a stretcher in a field hospital in 1944, somewhere behind the front lines in Italy. Shrapnel wound. Blood soaking through the bandage already. The morphine ran out an hour ago, and the wounded keep arriving faster than anyone can treat them. A nurse, out of options, fills a syringe with plain salt water and injects him, telling him calmly that it's morphine. Within minutes, he settles. The pain in his face eases. He looks almost identical to the man lying next to him who actually got the real drug. She wasn't cruel. She was stumbling into something an anesthesiologist named Henry Beecher would spend years studying once he made it home. What he found didn't just surprise him. It eventually changed how every drug in every pharmacy gets tested before it reaches you. Start with the part that shouldn't make sense at all. A sugar pill. Salt water in a syringe. Procedure that does nothing. None of it contains a single active ingredient. And yet, over and over, in study after study, patients taking these things report less pain, less nausea, less depression, sometimes improvements a doctor can actually measure, not just feelings a patient describes to sound polite. So what is happening inside someone who receives nothing and still gets better? Neuroscientist Fabrizio Benedetti wanted an answer that held up in a lab, not just a hunch from a hospital ward. He found that when a person truly anticipates relief, their body releases its own natural painkillers, endorphins, in response to a treatment that contains nothing. Give someone a fake painkiller, then quietly slip in a drug that blocks endorphins, and the effect vanishes almost instantly, which tells you something worth sitting with. The relief isn't imaginary. It's chemistry triggered by conviction alone. Belief, apparently, isn't just a quiet feeling tucked away somewhere in your skull. It's an instruction your nervous system can carry out. Benedetti found something even stranger studying Parkinson's patients, people whose neurons have lost the ability to produce enough dopamine on their own. Give them a dummy pill, but tell them it's their usual medication, and brain scans catch their own neurons firing out dopamine anyway, measured live on imaging equipment from a capsule holding nothing but filler. Some patients moved more freely within minutes. Tremors eased, not because of any chemical inside the capsule, but because the mind, expecting help, manufactured a burst of exactly what it was missing. The next part gets stranger still. A dummy treatment doesn't even need to look the same to work the same. Studies have found that color alone changes how strong people believe a pill will be, and sometimes how strong it actually turns out to be. Blue capsules, tested across different cultures, tend to feel calming. Red and yellow ones tend to feel energizing. Every single one of them is identical inside. Color alone is doing psychological work that ends in a physical result. Price plays the same trick. Behavioral economist Dan Ariely gave participants an inert painkiller and simply told half of them it cost 10 cents a pill, the other half $2.50. The group who thought they'd paid more reported noticeably stronger relief, despite every capsule in the study being chemically indistinguishable. An injection outperforms a pill. 2 pills outperform one. A bigger capsule beats a smaller one, even though every version does exactly nothing. Surgery beats almost all of it, which leads to one of the most unsettling experiments ever conducted on the subject. In 2002, researchers made real incisions in the knees of patients suffering chronic pain, exactly as they would for a genuine arthroscopic repair. For one group, surgeons stitched the knee back up without fixing anything at all. No repair. Just the cut, the anesthesia, the hospital bed, every ritual of surgery minus the actual surgery. 2 years later, that group reported the same improvement in pain and mobility as the patients who'd had the real procedure. Sit with that for a second. A completely fake operation matched a genuine one for years afterward. Now the part that flips everything you'd assume. You'd think a dummy treatment only works if the patient is fooled into thinking it's the real thing. Researcher Ted Kapchuk tested exactly that idea and broke it. He handed patients with irritable bowel syndrome a bottle explicitly labeled placebo pills, told them outright there was nothing active inside. They still reported meaningfully less pain than a group given no pill whatsoever. They knew. It said so on the label. And it still worked. Which means the ritual itself, the act of swallowing something, of being looked after, of anticipating a shift is coming, carries weight that has nothing to do with whether anyone deceived you. There's an uglier mirror to all of this. Tell someone a treatment might cause nausea, and a measurable number of them get nauseous off a capsule with nothing in it. Describe a side effect in vivid enough detail, and you can sometimes summon that exact symptom purely through dread. In one documented case, a man landed in an emergency room after swallowing an entire bottle of pills in a suicide attempt, blood pressure crashing, unmistakably in crisis. The pills turned out to be inert, leftovers from a drug trial. The moment doctors told him that, his symptoms lifted almost immediately. His body had spent the last hour reacting in full force to a poisoning that never chemically existed. Look at how much of ordinary medicine quietly runs on this same current. A white coat, a waiting room, clipboard, a stethoscope pressed to your chest. A doctor who spends 20 unhurried minutes with you tends to get better outcomes than one who rushes through in 5, prescribing the identical treatment, because unhurried attention is doing its own separate work. Fake acupuncture needles, ones that retract instead of piercing skin, produce real reported pain relief in plenty of patients, sometimes nearly matching needles placed at genuine points. A brand-name painkiller people trust more than the identical generic sitting one shelf over, cheaper molecule for molecule the same. None of that ceremony is fraudulent exactly. It's doing quiet psychological labor that your body converts into a physical outcome, whether or not anyone in the room meant for it to happen. None of this argues that belief can replace medicine. Antibiotics kill bacteria whether or not you trust them. Insulin lowers blood sugar no matter what anyone expects. This effect mostly moves subjective symptoms, pain, nausea, mood, fatigue, the felt experience of being unwell, rather than curing whatever is driving it underneath. But that felt experience isn't nothing. For an enormous number of conditions, how bad something feels is most of what a person is actually living through day to day. You've probably already lived a small version of this yourself, without noticing. A headache eases the moment you swallow the pill, before it could possibly have dissolved in your stomach yet. A vitamin makes you feel sharper an hour after taking it, faster than any nutrient could realistically reach your bloodstream. That's not you being gullible. That's the exact same machinery, running quietly, every single day, mostly unnoticed. So here's what's worth carrying with you. You are not a passive container that treatment gets poured into. Anticipation is an active ingredient, one your body has been quietly measuring and answering the whole time. In every waiting room you've sat in, every capsule you've swallowed, every time someone in a white coat told you, evenly, that relief was already on its way. That soldier on the stretcher wasn't tricked into healing. In a very real sense, his own body did something salt water alone could never manage. It just needed a reason to believe help had already arrived.